Hi guys. So Matt Hancock was interviewed by Sky News about the possibility of a second lockdown. Now, I have a few things to say about this during the video, so I'll let you listen to the first part and then I'll jump in with a response.
Health Secretary is with us this morning. Matt Hancock, of course. Mr. Hancock, good morning to you. 10 million people are now facing lockdown measures this morning. It isn't a local lockdown anymore, is it?
Well, yes, we did have to take action announced yesterday to bring in more measures in the northeast. And as we've discussed many times, we're prepared to bring in this local action wherever.
Her question was not about local action. Her question was national action. Matt Hancock either didn't hear the question or he's ignoring the question.
We think it's necessary. And with working with the councils across the northeast, we've taken this action. Ultimately, it's to keep people safe.
Yeah, SAGE scientists, as I said, no longer a local lockdown with 10 million people impacted. SAGE is saying...
Actually, maybe it is a local lockdown, just all the local lockdowns merge into one nation.
A 2-week national lockdown next month is the way forward. Is that the way we're heading?
Well, what I'd say, Kay, is that we really do need to come together to tackle this virus.
Why can you not be straight with people, Matt? I think actually people would have more respect for you if you actually just came out and were straight with them. Because Matt Hancock knows the criteria necessary to impose a lockdown. If he doesn't, I'd be extremely concerned. But I'm 99% sure that Matt Hancock knows what criteria is necessary in order to impose a lockdown. For example, it could be the R number has reached a certain level, or the number of new cases every day reaches a particular threshold, and then that's when we need to impose a lockdown. And I actually think people would have respect for him if he actually told the public. You know, he said, look, today we had 2,300 cases or whatever. When we reach 4,000 cases, we need to impose a lockdown. Now, when that date is, I can't say. It depends on how the public react. It depends on testing. It depends on how we're dealing with the pandemic in general. It depends on how many people are, using public transport. It depends on many factors. But this number we must avoid. As soon as we hit that number, we don't have any choice. The scientists have told us that we should impose a lockdown. That should be the message. So at least the public know, okay, are we safe? Are we getting closer to a lockdown? Are we doing enough? But instead, it's all vague and opaque. It's all about, well, we're looking at the data and we're considering this and we're considering that. I'm trying to help you, Matt.
Virus once again. The virus is clearly accelerating across the country. We've got to take the necessary action to keep people safe. The number of people in hospital is doubling every 8 days or so. And so you saw the action that I took yesterday across the northeast. We will do what it takes to keep people safe. This morning, we're publishing the social care winter plan to ensure we keep people safe in care homes, which is incredibly important. Yesterday, I put another £2.7 billion into the NHS to keep the NHS safe over winter and to expand, for instance, A&E facilities so they've got the space given social distancing. So we're doing everything we can to prepare, and we're absolutely prepared to take action if that's necessary.
OK, so in answer to my question, is a 2-week national lockdown, as proposed by some members of SAGE, on the cards next month?
Well, we'll do what is necessary to keep people safe. And the first line...
But just say, yes, it is. Because we have to keep everything on the table.
Line of defence is that everybody should follow the social distancing we've talked about many, many times, hands, face and space, and keep...
I don't know why he laughed there. Maybe he was laughing because I don't understand why he laughed. But this hands, face and space, what is it about? It's about blaming the public. Oh, we have new cases, we have problems. Well, it's because the first line of defense, you, the public, didn't follow the rules.
That's social distancing. The contact tracing system, which is working very well, that is the...
Are you joking me? Are you frigging joking me? The test and trace system is working well. Look, I uploaded a video just the other day where the head of test and trace is doing testing, but no bloody tracing. Baroness Harding was talking about how people in someone, she gave an example of someone in a restaurant who had one of their member of staff infected, and they did the wrong thing by asking the members of the other members of staff to get a test. For her, that was the wrong thing to do. She also said about families, if one of their a child in a family has a fever, the family decide to get tested. And she said, no, you don't do that. You don't do that. Which is actually part of the tracing part of the test and trace. So no, the test and trace is a shambles, and it's run by someone who doesn't understand testing and tracing.
The second line of defence. After that, these local lockdowns. And the last line of defence.
But the local lockdowns are not working because you're starting to see them spread out. Because the problem with the local lockdown is that certain things are kept out of the local lockdown. It's not a complete lockdown. And even if it were a complete lockdown, it's not, you don't monitor people who are moving in and out of the area. People are free to move from the lockdown area outside the lockdown area. So it's not really a lockdown.
Is full national action. And I don't want to see that, but we will do whatever is necessary.
But you can say that. You can say, look, I don't want to see a full national lockdown. But if it's necessary, we'll deal with it. And this is the criteria in order to achieve, like to alert or to switch on a national lockdown. I think it would help his case if he was honest with people, clear with them. So this is the criteria. If we hit this, then we have to impose a lockdown. And it's not my fault. This is the criteria.
To keep people safe in a very difficult pandemic.
So that is something that you're considering, a national lockdown?
Well, it isn't something that we ever take off the table, but...
Oh, just say yes. Why can't you say yes?
It isn't something that we want to see either. It is the last line of defence. But what I'd say this morning, Kay, is that the country once again needs to come together and recognise that there is a serious challenge, that the virus is accelerating. Unfortunately, it isn't just cases increasing, it's also the number of people ending up in hospital increasing. That's mainly, and in the mainly the number those sadly ending up in hospital are across the northwest of England, but we've seen a rise also across the northeast. And you've seen the action that I took yesterday, and we're prepared to do what it takes to keep people safe, whilst also protecting livelihoods, you know, balancing the need to protect lives and livelihoods.
No, you can't balance people's lives and businesses. You either protect one or the other. This is what is necessary. You can't make... This is, I think, what the problem has been since the beginning, is an attempt to balance saving lives and saving businesses. But you can't do that. You have to save one or the other. If you're saving lives, you have to say to businesses, we have to stay closed until we have protected the public. Unfortunately, it started off a little bit like that at the beginning of the lockdown, but by the 23rd of June, the lockdown was being eased while the number of new cases was still too high. Why did they ease the lockdown at that stage? Well, I speculated at the time was because they were coming under pressure from businesses, particularly businesses owned by Tories or supporters of the Tory party. They were putting pressure on the government to ease the lockdown because they wanted to make money. To hell with their staff and their employees. They wanted people back in the office, spending money in the local area. It was about saving the economy. Look, I understand I understand it's necessary to save the economy, but you can't fight two battles at the same time. You have to fight one, win, and then you deal with the economy after that. But the Tories didn't want to do that. They wanted to fight two battles.
In what everybody knows are very difficult circumstances.
How close are we to a second national lockdown?
Well, as you know, we keep all of these things under review, and we don't want to have a
See, how close are we? Look, you don't even have to give a date. You could say, when we arrive at this threshold, then we'll have to impose a lockdown. Once again, I think people would trust you if you said that. People would have more trust in you if you said that. But instead, it's all this where we're reviewing things and we're going to look at the data and we're going to listen to the scientists and we're going to, follow the rules. But this isn't enough of an incentive. You need to give people some sort of target. Let's say 4,000 new cases a day and say, okay, when we reach this level, we need to impose a lockdown. At the moment, we're not at that stage, so let's try and keep the number of new cases down by doing X, Y, and Z.
National action, it's the last line of defence. Hence the very significant local action that I took yesterday, and we'll be making further announcements in the normal way later today. Doing that work with local councils who are right there on the front line.
So it's all about what other people have to do. The local councils have to pick up the pace. The public need to follow the rules. Like, for example, why doesn't Boris Johnson restart the daily briefings? If new cases are starting to increase, if you're seeing a rise in new cases, wouldn't it be a good idea to restart the daily briefings, saying this is what's happening every day? Convince the public that, look, we're starting a second wave. We need to get back into gear with dealing with it. There seems to be this attempt to ignore the problem once again.
Trying to find all the positive cases, that's very important. But we do have to recognise that the number of cases is rising, and we do have to act because we know, especially from looking at other countries, that inexorably leads to more hospitalisations and sadly more deaths. And that is what we want to minimise, and we want to protect people's livelihoods at the same time.
My viewers are on the edge of their seat this morning listening to you, Health Secretary. You quote figures at them all the time, not just you, but your colleagues in government as well, quite rightly. You make comparisons with other countries in Europe, whether it's test and trace or the number of cases. We know that 10 million people are going to be in localised lockdown. My question to you is, what are you looking at to decide whether there will be a second national lockdown next month, and how close are we to that?
Well, what we look at is, first and foremost, the number of cases. Secondly, the survey that's put out each week on a Friday lunchtime by the Office for National Statistics. That is the single best tool that we have, because that takes into account the fact that the number of tests has been rising.
But it's like saying, how far is it from your home to the centre of the town? Well, we use a measuring tool. Okay, but can we see the measuring tool? No. Okay, but how do we know how close we are or not? You're saying, yes, we use different tools to understand how close we are to a second lockdown or whatever. But you're not describing what those tools look like. You're not describing the data that's inside. It would help if you actually were transparent. I know it's probably a big problem for the Conservative Party to be transparent. But even just on this one issue, if you were transparent, saying, look, these are the number of deaths we've had. These are the number of new cases. This is what we need to do. We need to keep it below this level.
Which obviously impacts on the number of positive results that you get through. We also look at the number of people being hospitalised with COVID, because that's when it gets very real. And so they're the three main figures, and we look at all sorts of other pieces of information and data as well. What I'd say is that I also want to give a bit of hope. We've seen in France and Spain the number of cases really shooting up, but we also saw that in Belgium they had a start of a second spike, quite similar to what we've seen over the last few weeks here, and then they took action, and then it came down.
So when Matt Hancock said that the number of new cases in Belgium had come down, I was a bit surprised, and I went to look at this data. This is from the World Meters Info website. If you actually put it into Google, you'll find the exact same information that I'm looking at here. Just go into Google and put in coronavirus Belgium, and it'll show you the data. And this is new cases on the 18th of September. Now, when I'm recording this video, it's the 19th of September. And there were 2,000 new cases yesterday. So I don't know what Matt Hancock is talking about, how cases are coming down in Belgium. It doesn't make any sense to me.
Came down because the country, once again, came together to tackle the virus. In Belgium,
it's not how... But, okay, even if it did come down... I don't know how he's saying it came down. It didn't come down, it went up. But he has this idea that coming together is some sort of silver bullet to stop the pandemic. Yes, the public are very important in dealing with this pandemic. But of course, the government is also very important. And what he's doing is he's shifting the blame, of course, onto the responsibility onto the public. And then if it doesn't work, well, the public didn't follow the rules.
Belgium, for instance, they introduced a rule of 5. We've introduced a rule of 6. If people follow the rule of 6, if people follow the local lockdown rules in the areas like in the northeast and Greater Manchester and other parts of the northwest, across Birmingham and parts of the West Midlands, if people follow the rules, the rule of 6 for everybody, and then the local action where that's necessary, then we can come together and defeat this virus. But
no, we cannot. And I wish he would stop saying these things. It's frustrating to listen to. He said, yeah, if the public follow these rules, then we defeat the virus. No, we're not defeating the virus. Stop saying you're defeating the virus. The only way you defeat the virus is with a friggin' vaccine. We can control it. We can limit its spread, but we can't kill it. We need a vaccine in order to do that. So any action that we take in order to keep the numbers down have to be until we have some vaccine or some type of treatment. That's why I said that it's too early to impose to ease the lockdown. When you have the numbers sufficiently suppressed, you can slowly ease the lockdown and continually monitor the situation. As soon as you see new cases, you test and trace when the cases are low. What the UK is trying to do now is to do test and trace when it's too late. When you have thousands of cases every day, it's almost impossible to test and trace all of those people. You know, if you have 1,000 cases and those 1,000 people came into contact with, let's say, 10 people, how many people are you going to test then? And then, but that's not. It doesn't stop there. If you find people who came into contact with the first group and were infected, you have to trace also the contacts that they had. So that's why it's much easier to do it at the beginning when you have a smaller number of cases, like what they did in South Korea. But instead, what you're doing now is you're doing it completely wrong as well. And I was shaking when I heard Baroness Harding saying, well, you know, we're not going to actually basically what she was saying, we're not going to trace. We're going to test, but we're not going to trace. Maybe you've just given up on tracing. We'll just say, look, we'll just test. That's it. Maybe that would actually be a better approach than just wasting time tracing, because it is actually at this stage a waste of time. That's all I really have to say on this. It doesn't get much better after this. I do recommend watching the video if you want to watch it yourself. I'm concerned. it's looking more and more likely that there's a second wave. And I think Matt Hancock, once again, should be clear with the public, be straight with the public and say, this is the criteria. If we hit this threshold, we need to impose a lockdown. And I think he's trying to avoid it, maybe because he doesn't want to upset donors of his party. He doesn't want to upset the public. He doesn't want to look weak. I don't know. But it's dangerous what he's doing. It's a dangerous game he's playing. Let me know in the comment section, guys, what you think. As always, your comments are greatly appreciated. Thanks a lot. I want to say a big thank you to all of my patrons. You ensure that this channel continues to exist. I'm eternally grateful for all of your support. If you join Patreon, you will receive instant access to our Discord server, where we have both audio and video chats. You can chat with me and other patrons, where we discuss important and non-important issues. Becoming a patron per month costs about the same as a large coffee, so why not check it out?